perception and recollection. We had a great session today on the medical legal aspects. This was Dr. Mazuri took on perception and recollection of risks and benefits in neurosurgical patients. And Dr. Mazuri is from Manchester. Away you go.
Hi, my name is Amr Morsi, one of the neurosurgical registrar in Salford Royal Hospital in Manchester. This is an interesting study was done to find out the patient recollection of risks and benefits that they learn about it in the consent under our traditional consent process. And that was done through recruiting 50 patients awaiting spinal surgery. And we asked them simple questions to test their ability to understand and recollect the consent content in 3 time stages. So before the operation by week, and then at the day of surgery, and also after the surgery by 10 days. So the standard was the British Association of Spine Surgeons booklet and the clinic letter. In terms of understanding of the benefits and risk of surgery, all patients thought they were able to almost fully understand the aims and risk of surgery. However, surprisingly, patients did not remember most of the given information mentioned in the consultant clinical letter. The best recollection score was only 3rd. Another interesting finding that most of remembered risks by the patients was death and paralysis. In conclusion, patients were generally confident that they understand the benefits and risk of surgery. However, they remember less than 1/3 of the risks mentioned in the clinic letters. Patients retain the most serious complications like death and paralysis. However, patients don't recollect the most common complications. And finally, innovative ways should be integrated into current consent process to improve patients' understanding and recollection of risks of surgery. Thank you.
Well done, Emma. It's a really important question. In terms of, we discussed this today about what sort of mark should you get in any kind of assessment to work out whether you've actually retained the information or not. Paul, any thoughts?
No, I agree. It's important. I wondered if if you've had any experience of people recording them on their phones and whether that's good or whether there should be something more formal in terms of how it's documented to help them remember the risks and benefits.
I think the people that read the booklet itself in the clinic and reading about the operation itself, they tend to retain more information than usual, depend on what the consultant or the surgeon told the patient and describe everything. So no matter the consultant do his best to explain everything in simple words, the patient tend to forget about the risks and benefits and the possible side effect that can happen in the operation. So I think it's depend on the patient and also depend on the consultant. So it's two part of the equation to reach a good retaining of information.
Brilliant. Thank you very much. Okay.